invite to talk today about the role of parents in pediatric chronic kidney disease. I'm Dr. von Tilburg. I'm a health psychologist by training, and I run a research lab focused on parental factors in childhood chronic disease. Very honored to be here today. I have no disclosures to report related to this talk. Today, I'll be talking about parents and how we can help manage their child's disease better. Now, as all pediatricians know, parents or other caregivers, I will just address them in this talk as parents, are incredibly important in their child's life. You may see a patient once every 3 months, 6 months, 12 months, depending on how much they need to come in. But a parent deals with the child's disease every single day. They really are best allies to improve child's health. Parents take important decisions every day related to their child's health. They decide, for example, when to take a child to the doctor, when to fill their medications, which treatments to choose. They decide if they need to stay out of school, etc. Now, in addition, children learn from their parents about their disease and how to cope with that disease. We simply cannot operate without recognizing the deep effects that parents have on child health outcomes. When parents are stressed, their children's outcomes suffer. And during this pandemic that we're currently in, parents are stressed. They have to deal with online schooling for their children and combining that with working, often from home, losing their jobs or having reductions in pay and income, closures of medical settings and medical facilities, and shortages of certain supplies. But families were changing well before this pandemic as well. There are more one-parent households right now than ever before. 1 in 4 children lives in a single-parent household. And if mom is the only parent, families are 5 times more likely to live in poverty. There are more mothers in the workplace as well. And for many children, this means spending time in low-quality childcare. Parents can also often be sandwich parents, pressed between the needs to take care of their children and their ailing parents. And all of this matters. Now, how a parent copes with that is very important. When a child is born with a disability, often our parents are shared this world-famous poem by Emily Pearl Kingsley. And if you haven't read it yet, I recommend you Google it. It compares having a child with a vacation to Italy. You look forward to spending to the splendid culture, the nature, the weather, all the fantastic things this country has to offer. But instead, you arrive in Holland, where very pragmatic people go about their very practical lives, despite the everlasting gray skies. However, as Kingsley points out, if you spend your life mourning the fact that you didn't go to Italy, you may never be free to enjoy the very special and very lovely things about Holland. Think about tulip fields, quaint fishing villages, and windmills. How can we get parents to learn to navigate Holland? So let's talk about navigating chronic kidney disease. How do parents affect a child's outcome? Parents do all kinds of practical things for their children, such as making sure they eat well, they exercise, go to school, take their medications, etc. And these are very important, of course, for disease outcomes in CKD. But above and beyond these, parents support their children emotionally and teach them skills they need in their daily lives as an adult. When parents are stressed, worried, and distracted, they cannot support their child as well. The main worries of parents of healthy children is the health of their children, such as, do they get enough exercise? Are they eating healthy? What about violence or accidents, drug abuse, and bullying? Now imagine having a child with a chronic disease on top of all of that and having to worry about the threat of this disease for the children's physical and mental well-being. Parents' primary role is to protect their children. This is made much more difficult if the child has a chronic disease such as CKD. And I touched upon this pandemic a little, but in a recent study, we found that parental stress went through the roof during this pandemic. Half of all parents lost work or pay. 80% of children switched to online or homeschooling early on in the pandemic. And only about 1 in 5 parents reported having someone to rely on to help with childcare. And this was mostly their partner. Less than 1% could rely on others, such as grandparents, sitters, or daycare. Now, understandably, the rates of clinical depression and anxiety were very high. In this sample, they were above 40%, when usually these hover around 10 or 20%. Especially parents of children with chronic diseases were stressed. They reported dealing with canceled medical appointments, reduced access to specialty foods and supplies, and all of this increases caregiver burden, which then can affect child outcomes. From one of our previous studies in our own lab, we know that caregiving burden is high amongst children or amongst parents of children with chronic diseases. And we can predict caregiver burden by the intensity of the treatment regimen, as well as the child's comorbid ADHD. Now, these are not factors we can change or influence easily. However, there was one factor that we can change, and this is child's self-efficacy, or the child's belief that they can master certain skills. Unfortunately, child's self-efficacy is often not supported or developed by parents. Why is that the case? The problem, quote unquote, here is helicopter parenting. Helicopter parenting robs a child from the ability to develop the mastery of skills and learn from their failures. And this is because parents swoop in to protect their child from uncomfortable experiences. Helicopter parenting is such an accepted form of parenting practiced all over the US and many other countries. It has gotten a bad name, but the vast majority of parents still practice it. They just don't recognize it as such. To them, their own behavior makes a lot of sense, but the behavior of other parents does not. And this is because we talk about helicopter parenting as a behavior which easily seems unreasonable without any context. But helicopter parenting is more about parental worries. Within the context of worries, it makes a lot of sense to always check your child's homework well into high school. After all, bad grades mean reduced chances of getting into a good college. And in this scenario, developing independent skills and self-efficacy suffers, which gives more reasons for parents to swoop in. Well, generally, I agree that I shouldn't spy on my teen's whereabouts, but my teen would get lost without it and in trouble. So I kind of have to. Now, where do these worries come from? Children are a lot safer and healthier today than they were ever before, yet parents worry more. For example, only 64% of parents trust their 9 to 12-year-olds to call 911 when needed. Toddlers can also be taught this. Why do parents not trust their preteens to do so? One of the reasons may be that parents overestimate risk. For example, we hear about child abductions all the time, so parents are reluctant to have children walk home from schools by themselves. But child abductions are incredibly rare. Parents also underestimate the child's functioning. For example, in this study of CKD patients, parents consistently rated their child's quality of life lower than their children did. This overestimation of risk and underestimation of the child's skills and well-being powerfully induces the need to protect your vulnerable child in this cruel world. But protection has its side effects. It hinders the development of age-appropriate skills. 17 to 8-year-olds should be almost completely independent from their parents, other than perhaps financial support that they need if they're continuing their education. However, this is not the case. Parents keep worrying about which tasks these teens can be trusted with. including everyday tasks such as what to eat or how to handle minor cuts, scrapes, and scratches. This lack of trust invades the medical office as well. Parents take on a primary role of their child's medical care well into their teens. 65% of parents with the teen completed a health history form for them. 17% make decisions about vaccine. And even if the teen does have a voice, it's shared with the parents. Few have the opportunity to actually practice being independent, making their own choices in the doctor's office with just the gentle support of their parents. And we see similar effects of helicopter parenting in youth with chronic diseases. 8 in 10 parents remain involved even when their child is a young adult and has transitioned to adult care. Therefore, it should come as no surprise that medical independence is not established until young adulthood, when circumstances such as moving to college and away from home force parents to give up some of the responsibility. And we see the same issues for children with chronic diseases. In 2 studies, we found that teens learn many skills needed for successful transitioning from pediatric to adult healthcare, but self-management skills are not mastered until after the age of 20. Now, so what? You may say. Adolescence and dependence on parents is much longer nowadays, and no one is expecting an 18-year-old to be completely independent. Well, I'm not advocating that parents drop their care for their teens or young adults. It's one thing to know the skills, but practice them in loving support of the family, but quite another when parents do not allow their children to practice at all. Parents have been found to be one of the major barriers in developing skills and knowledge needed for healthcare transition and readiness. This is problematic as teens prefer to learn from their parents about their condition and how to take care of themselves. We clearly need to make sure that parents have the correct knowledge, skills, and willingness to share this information with their children. The story on parents and children's health is not all doom. Parents play an incredibly important role, and it's a supportive role. We know from various studies that parental involvement in their child's care is associated with better adherence and better outcomes for the children. If parents cannot fully take on this role, for example, when there's conflict in the family, adherence suffers. But parents should not take 100% control of an older child's care. Children who can learn from their families and increase their self-efficacy have better knowledge, skills, and adherence. It is very hard to change parents' behaviors. You have to change the reason behind the behavior. In other words, you change how parents think and feel about their child's disease in order to change their behaviors. So we set out to discover which reasons parents might have to helicopter. And we had several hypotheses: threat, parental overload, and parenting philosophy, and I will discuss each of them. Overprotection of parents of their children often happens to protect their children from a future threat. In studies of children with abdominal pain, it's well established that parental threat perception of the pain, or how bad it is for their children, predict protective behaviors such as not allowing their child to go to school when in pain. In a randomized controlled trial of cognitive behavioral therapy, we examined which factors predicted reductions in childhood symptoms. We found that the reduction of parental threat was the most important mechanism by which CBT works for these children. A chronic disease includes future threat for many children. For example, for children with CKD, there's a threat of needing a future transplant. For children with inflammatory bowel disease, It may be the need for bowel surgery or living with a stoma for the rest of their lives. And death is always sort of on the horizon for parents. This doesn't even include a threat on social and emotional well-being for the child. So there's plenty of threat to go around, and we decided to test the influence of parental threat perception on the willingness of parents to allow their child to learn skills needed for independence. To our surprise, we found no associations between threat perception and youth healthcare transition readiness. So then we hypothesized that immediate threat may be more important than a distant threat in the future. Most people don't follow exercise and diet recommendations until after a health scare such as a heart attack. So we compared youth who are symptomatic, and any lapses of self-management may be immediately noticed by symptoms, versus those who are asymptomatic. Or, in other words, children with inflammatory bowel disease, symptomatic, and chronic kidney disease, often asymptomatic. We found no differences in healthcare transition readiness between those two groups. So clearly symptoms are related to transition readiness. We did find a correlation between the difficulty of managing the child's disease and youth transition readiness. And this made us think that it could be partly parental overload that prevents the development of youth self-management skills. After all, teens learn from their parents, and if the parent is too busy to be teaching, well, again, we tested this in a sample of youth with chronic diseases and found no association between parental overload and youth self-reported transition readiness. However, parents who were overloaded did believe the child was not mature enough to be independent. So clearly, threat and overload aren't driving the lack of independence of the children in their medical care. So we decided to look at general approaches to parenting. Bauman's parenting styles is very well validated and has been used in thousands of studies, which shows associations with child outcomes. The parenting styles differ on how much warmth a parent gives and how much controls or rules a parent has. Authoritarian parenting is cold and controlling. These parents focus on discipline and obedience. Authoritative parents also focus on control. They enforce rules, but they do so warmly. They have high expectations, but within a loving and positive relationship with their child. Permissive parents have a lot of warmth, but no rules at all. They kind of think that kids should just be kids. And then there's a small group of uninvolved parents. They have no warmth and no rules. The children are left to fend for themselves and get little in terms of attention or nurturing. Most parents are either authoritarian, authoritative, or permissive. And in studies, authoritative parenting or control combined with warmth has been found to be associated with positive child outcomes. Now, in children with chronic kidney disease and diabetes, we found that warm parenting styles, both authoritative and permissive, were associated with less transition readiness. This is odd as it contradicts many studies showing authoritative parenting is associated with better child outcomes. Perhaps trying to understand the struggles of a child makes parents jump in more easily to protect them. More fodder for students for studies to come in the future. So what have we learned today and how can you apply this? First, parents are an important factor in a child's life. I'm not telling you anything new. They're the main ones taking care of the child's disease, the main ones from whom children learn how to manage the disease, and parental involvement is important as it increases adherence to treatment. Make sure you involve parents early and often. Check that the parents have correct understanding and how to make appointments how to deal with insurance, make sure they have adequate housing, food, etc. Involve a social worker if needed. Now, parents who are overprotective and unwilling to give their children and teens age-appropriate responsibilities need some help as well. I would advise you to set up a plan for the family where youth is allowed to practice skills with parental oversight, slowly diminishing. There might be some very highly anxious families who need a referral to a psychologist, but most parents will be fine. Parents tend to naturally oscillate between doing too much and doing too little all the time. So with a little guidance and some clear rules, they can be coaxed into falling more one way or the other. The question invariably becomes, what do you do with the uninvolved parent? There may not be many, but no parental involvement may be worse than over-involvement. Usually there's a reason why parents cannot be involved. I recommend you screen for depression and refer as needed. Depression is marked by inaction and can play a big role. Second, think about how society and systems may prevent parents from being able to be involved. A parent who has to work 3 jobs to provide food and a roof has little time or energy left for their child's needs. Parents may not have transportation to take them to medical appointments or have no access to stores with healthy food, etc. Again, a social worker can help with some of this. Also, do not forget that some cultures may parent differently than us here in the US. That does not mean they're doing anything wrong. All cultures have different approaches to children, and most will grow up to be happy and healthy. For example, in the Netherlands, where I'm from, children are taught from a very early age to be independent. From a very young age, they learn to negotiate with adults, and they learn that their voices are to be heard and respected. Children are also largely left by themselves to deal with their own battles. My own children therefore call me mildly neglectful, because that is what it appears like from an American perspective. Yet, according to United Nations, Dutch children are the happiest in the world. So get to know cultural aspects of parenting. Read a lot about different cultures. The Spirit Catches You and You Fall Down is a great introduction. It's a good book, and if you haven't read it, you should. Now, revise your treatment plan according to the family's cultural values. Think if you really need to do something because you just always have done it that way. I bet there's room for flexibility. And just remember that an adherent parent to maybe a less than optimal plan may be better than a completely non-adherent parent. And lastly, when parents cannot be involved, no matter the reason, look for other adults in the child's life who can help. What about grandparents, aunts and uncles, neighbors, teachers, etc.? I hope that you've learned something more about how to approach to involve parents in their children's care, and I'm happy to take any questions at a later time. Thank you.